Vaginal yeast infection. A vaginal yeast infection is a fungal infection that produces inflammation, discharge, and extreme itching in the vagina and vulva. Vaginal yeast infection, also referred to as vaginal candidiasis, affects up to 3 out of 4 females at some point in their lives. Many females have 2 or more episodes. A yeast infection in the genital region is not regarded as sexually transmitted disease. However, there is an increased chance of vaginal yeast infection during the first few months of regular sexual contact. Infections may be connected to mouth-to-genital contact, according to some data on oral genital sex. Prescribed medications can be used to treat vaginal yeast infections efficiently. What are the symptoms of a yeast infection? Itching and irritation in the vaginal regions. A burning feeling, particularly during intercourse or urination. The vulva is reddened or swollen. Soreness and discomfort in the vaginal canal. Rashes on the cervix. Vaginal discharge that looks like cottage cheese and it is thick, white, and odor-free. Vaginal discharge that is both watery and frothy. What causes yeast infections? Candida albicans is the fungus that causes most vaginal yeast infections. The vaginal environment contains a healthy balance of bacteria and yeast, including Candida. Lactobacillus bacteria prevent yeast overgrowth. This balance, however, can be upset. The signs and symptoms of a yeast infection are caused by Candida overgrowth. The following are some causes of a yeast infection. Using too many antibiotics, which produces an imbalance in normal vaginal flora. Being pregnant. Having diabetes that is not under control. Having a weakened immune system. Using estrogen-boosting oral contraceptives. Factors that increases your risk of getting a yeast infection. The first factor is if your estrogen levels have increased. Yeast infections are more common in women who have higher estrogen levels, such as pregnant women or those who use high-dose estrogen birth control pills or estrogen hormone therapy. The second factor is if you have diabetes that is out of control. Yeast infections are more likely in women with poorly managed blood sugar than in women with well-controlled blood sugar. The following could help you stay away from a yeast infection. Don't wear tight panties. Don't douche. Douching destroys some healthy bacteria in the vaginal area that protects you from illness. Avoid perfumed feminine hygiene items such as bubble bath, pads, and tampons. Avoid hot spas and steamy baths. Avoid spending too much time in wet clothing such as swimsuits and gym outfits. When should you consult a physician? If you are experiencing any of the symptoms mentioned, you should see your doctor. If you are unsure whether or not you have a yeast infection. If over-the-counter antifungal vaginal creams or suppositories haven't alleviated your symptoms, consult your doctor. See your doctor if other signs and symptoms begin to appear. If you want to know how to prevent cancer, watch the next video that will appear on the screen.